My name is Naomi Reed. I'm a speech and language therapist and I work for the children's therapies team. Something that we have had to change in terms of our practice during COVID is the way we deliver our training. We have a really fantastic brochure full of all sorts of training for parents and for school staff that we're going to run all the way through the year. We started this earlier in the year, around kind of January, February, and we designed all our training to be kind of face-to-face and really interactive, so it could be as effective as possible. However, as the academic year has started and we've started delivering our training, of course we can't deliver it one-to-one, we can't deliver it face-to-face. So we've had to go digital instead. Children's therapies have been really forward thinking, almost from the very start of lockdown. Our managers were really helpful to us in helping us to provide virtual therapy, and it meant that we had to be really flexible and be willing to make lots of mistakes and have lots of embarrassing things happen, but we had real support from our managers who spoke to IT and spoke to other areas in the trust about what's the best thing that we can use, and we tried all the different kind of ways of virtual conferencing. So actually, come September and we need to do our training online, we actually have all the best technology set up already. We have loads of webcams and microphones and things like that to use. And so first of all, we've tried Microsoft Teams because schools are very familiar with Microsoft Teams. I am personally doing training in PECs and intensive interaction, and they are approaches that we use for children with very complex needs. And as that's gone on, we've had variable success. We've had lots of difficulties with certain members of staff being able to access and have access to a laptop and have access to the technology. So now we're moving to WebEx, and now we've got access to the WebEx training program as well, which should really work. We can have breakout rooms and try and make the training as interactive and as effective as possible. So we've had to change our training and make sure that all our resources and our slides are as interesting as possible so that we can send them up beforehand. We're using lots and lots of videos. We've got we've spent lots of time finding all the best YouTube videos that really describe the approaches that we're using. And we've made how-to guides for how teaching staff and parents can access the technology and get onto the virtual meetings. And we've had to do lots of practicing between us with breakout rooms to make sure everything goes as smoothly as possible. So it's taken lots of trial and error and lots of organisation, but we've really worked together as a team, and our managers have really supported us in using the technology, and we've had some real success so far. And hopefully by the end of the academic year, we may be back to face-to-face training, or we'll just be absolute experts in virtual conferencing.